School Social Work Response to COVID-19 by Angela Bellinger, Jenny Ha, Rosa Ramirez Arredondo, Ashley Santos, Caitlin Simpson, and Chakima Stapleton. Although this may be a difficult time for many children, social distancing should not equate isolation. Over 135,000 public and private institutions across the country have canceled classes for the remainder of the school year. These precautionary measures were put in place to slow the spread of COVID-19, and as a result, millions of children were not receiving the necessary services that are provided by their school district's social services department. Community demographics. COVID-19 has changed the way of life for millions of children across our country. Therefore, no one is immune. The links that are listed below provide more detailed information and statistical data for state-by-state information. The following are some of the responsibilities of school social workers. Crisis intervention. Provide mental health services to students. Develop and monitor interventions. Assist with conflict resolution and anger management. Help children develop appropriate social skills. Provide staff with essential information to better assess students with mental health concerns. Develop staff training programs. Help teachers design behavior management programs. And provide direct support to staff. Why should we care? Due to the COVID-19 pandemic, millions of schools across the country were required to close, which meant a discontinuation of services to students that are in need. And as a result of this drastic change, many children may often feel stressed, anxious, and isolated. Because of this limited access, many children are left with nowhere to turn. This could lead to poor academic achievement and regressive behaviors. The topics that are our primary concern and that we wish to target are student mental health, behavioral management, student social support, special education, food resources, and parental support. Student mental health. Social workers often serve as the primary mental health providers for students and may be the only counseling professionals available to students and their families. As a result, we want to continue to provide essential mental health services to the students, including the following: crisis intervention, intervention strategies to increase academic success, access, refer, and help students dealing with mental health concerns. Our main concerns in handling situations concerning student mental health are the following. How can we help students stay connected to one another? Also, how can we help students deal with the negative feelings associated with the pandemic? Things such as being away from friends, peers, loss in routine, being unable to finish the school year, being unable to participate in life transitions, things such as graduation and prom. How can we provide support to families? Family stress may be high at the moment. We want to avoid situations that could put a child at risk for abuse. Some of the potential interventions could be: provide a weekly challenge activity for students to participate in and share on social media. Virtual one-on-one mental health sessions with the students. Virtual support groups. And also a mental health helpline to assist students and their parents with grief. Behavioral management in response to COVID-19. Behavioral changes are often a common occurrence in children during a pandemic. Adjusting to the changes in everyday life can lead to anger, frustration, and violent outbursts. Telehealth services are offered to provide useful resources for children that are having a difficult time adjusting to their new normal. Interventions could include video lessons, Simon Says, and play therapy. The Crisis Team text line is a student support resource that is available for youth and young adults ages 13 through 22. Their contact information is 504-777-EASE or 504-777-3273. This service is free and confidential. It operates 24 hours a day, 7 days a week. And there also is a text line. You can text HOME to 741-741. And a crisis intervention specialist will respond as soon as possible. There are many children across our country that are faced with the reality that they may not graduate from high school. An alternative idea for graduation could include the event could be live streamed, uploaded to a website, digital files should be available for students to keep, graduates should be able to submit their own photos, the graduates' names should be read and displayed during the presentation, the school's logo and colors can be also incorporated into the video. Special education in response to COVID-19. According to the U.S. Department of Education, there is no particular guidelines for extended school closings in response to unusual situations. If a school district does not provide any educational services to students during the time schools are closed, then special education services are not required. When services are provided to general education students, special education services must resume at that time. Per the Individual with Disability Education Act, students who have disabilities must receive a free and appropriate public education in the least restrictive environment. Also, the IEP points out that plans must be created for every child who receives special education. These guidelines must contain the child's current performance, realistic and measurable goals, any special education services or changes if needed, how progress will be measured, if and how the child will engage in state and district-wide testing, any transition services needed, active or no engagement with mainstream students. IEPs can be revised as needed, although they must be followed. Special education interventions. There are many interventions for children with disabilities during the COVID-19 pandemic. Besides continuing the schoolwork given by the school and keeping a schedule to help reduce stress, social workers can encourage parents to use fun games and activities to engage their child while continuing to meet their IEP goals. There are intervention games such as the clapping game, Simon Says, conversation Jenga, the telephone game, free dance, and guess who. These interventions can help the child work on social and listening skills while having fun with their family. Fun writing prompts can also be used for school or general conversation starters for a child with a disability. There are many apps that can help reduce anxiety and work on mindfulness, such as Stop, Breathe, Think, Calm, and Headspace. Audible is an app that is currently free to children to be able to listen to books. DIY sensory recipes is another wonderful resource for parents to work on with their children. Social workers can provide support to the families in the following ways. School social workers can work with parents to facilitate their support in their child's school adjustment and success. They can also help alleviate family stress, which enables the student to succeed in their new learning environment. They could help the parent find available programs for students with special needs. Lastly, they could assist the parents in assessing and utilizing available resources in the community and through the school. Our social media campaign is an optional way for students to connect with one another. It will be a way for students to have fun and share creative ways to get through the pandemic together. Each week, students will be given a prompt which they can participate in and share on social media by tagging us on Instagram at School Social Work Care. We hope to reach and engage students throughout the district to help them combat isolation and promote mental well-being and physical health. The previous activities will revolve around the following themes: staying active, gratitude, let's meditate, self-reflection, dance party, acts of kindness, and self-care. The following are weekly challenges that will be implemented in our program. Stay active. First, we will provide the students with a challenge to show us they plan on staying active through the pandemic, as staying active can have a great impact on one's physical and mental well-being. Acts of kindness. Our second challenge will consist of students sharing with us and their fellow students ways they plan on giving back. Giving to others can help reduce stress and provide us with a sense of purpose. Self-care. In this challenge, we want to remind our students to take care of themselves through this difficult time, whether that is setting aside time to read a book, play a video game, or go for a walk. We want to see how students are taking a break from their remote learning activities. The following are ways that we will evaluate the success of our activities. We will look at the amount of times the Instagram posts have been shared and liked. We will look at the amount of video reactions to the challenges. We will gauge the amount of interest and participation based on reactions. We will create metrics in order to measure goals. We will create online surveys to determine how useful and entertaining the weekly challenges are.